Hello, I'm Dr. E. Barry Gordon. This video has been divided into two parts because of YouTube length limitations. The intact video can be seen on my website, www.thehiddendisease.com. Hello, I'm Dr. E. Barry Gordon, and this is my 19th video about the disease testosterone deficiency. I've changed the order of the videos a bit. This and the next will be about the most important women's health issue of our time, breast cancer. And then we'll get into videos 17 and 18 about diabetes. Few things in medicine have been more confusing and controversial than the relationship between the hormones produced by the ovaries and breast cancer. I presented my view of standard hormone replacement therapy, meaning the replacement of the female hormones estrogen and progesterone in postmenopausal women, in video 9 of this series. Today I'm going to present the case for my belief that a progressive deficiency of testosterone is a primary underlying cause of breast cancer. As in prior videos, I'm going to change the wording of some of the studies I quote to make them more easily understood. The unaltered abstracts are on my website, www.thehiddendisease.com. Also, I want to make it very clear at the outset that I am not an expert on breast cancer, and I have not done any new research on the subject. What I have done is three things. I've put some deeper thought into currently accepted medical beliefs that have never made any sense to me. I've taken a step back to see if there was any related medical knowledge that might shed some light on the puzzle. And I've taken a look at what some of the less publicized medical literature has to say on the subject. Any discussion of breast cancer has to include the subject of female hormone replacement, giving a postmenopausal woman estrogen and progesterone, because it is fairly well proven that female hormone replacement does increase the risk of breast cancer. I've always had a problem believing that the mere presence of adequate levels of estrogen and progesterone, which just a few years earlier were a vital component of a woman's good health, would suddenly one day turn into a cause of cancer. Having said that, as you will see, I realized that giving postmenopausal women these two hormones should lead to increased rates of breast cancer. And now I understand why. It's important to keep in mind that this long debated female hormone replacement issue does not involve the many, many women who get breast cancer before they reach their menopause. Female hormone replacement certainly has nothing to do with their cancers. Questions about the causes of breast cancer, therefore, must include female hormone replacement, but go well beyond that issue. A more fundamental and non-controversial fact about breast cancer is that the older the woman, the more likely the breast cancer. In other words, as women age and their female hormone levels continue to fall, their risk of getting breast cancer rises. So let's look closely at the current situation. Medical research has proven that decreasing female hormone levels due to age and increasing female hormone levels due to replacement both predispose to breast cancer. Doesn't it sound like there's something wrong here? Doesn't it seem likely that there's something else involved, something that's common to both age-related female hormone loss and replaced female hormone increase? There is a condition that explains this dichotomy perfectly: testosterone deficiency. I'm convinced that the absence of sufficient testosterone in the presence of estrogen and progesterone is a primary or the primary cause of breast cancer. Let's look at the facts, starting with women who never take female hormone replacement. It is well established that women begin to lose testosterone between the ages of 25 and 35. Let's call 30 the average age. The average age for menopause is 51, a 20-year difference. It might be argued that female hormone levels begin to decline before the actual end of menstruation, but we certainly have at least a 10 to 15-year span between the beginning of the loss of testosterone and the beginning of the loss of the female hormones estrogen and progesterone. During this decade plus, these premenopausal women obviously have adequate amounts of estrogen and progesterone, but certainly less than adequate amounts of testosterone. It has been repeatedly proven that estrogen and progesterone, in the absence of sufficient testosterone, are irritating to breast tissue. I'm going to repeat that. It has been repeatedly proven that estrogen and progesterone, in the absence of sufficient testosterone, are irritating to breast tissue. 2 studies on this issue were done by the National Institute of Health. They were published together in the July-August 2003 issue of the journal Menopause. The National Institute of Health scientists were investigating some prior evidence that estrogen can irritate breast tissue and that testosterone normally acts to prevent this estrogen effect, and that testosterone, quote, thereby may protect against breast cancer, close quote. That's the National Institute of Health 5 years ago. In the first study, they deprived female monkeys of testosterone and found a doubling of breast cell activity, quote, indicating that testosterone normally inhibits excessive breast cell activity, close quote. Is it just a coincidence that the incidence of breast cancer starts to rise rapidly around the age of 40, an age when women have their full quantities of estrogen and progesterone, but have been losing testosterone for about 10 years? I think not. Is it just a coincidence that women start to get breast cancer at the same age they begin to suffer the early symptoms of testosterone deficiency? I think not. How does this finding of breast irritation from the lack of testosterone fit in with the risk of breast cancer increasing in women as they grow older? As we've seen, the loss of testosterone in women begins at a much earlier age than the loss of their female hormones, creating a 10 to 15-year span between the onset of symptoms of these deficiencies. It's also obvious that the effects of testosterone loss, such as weakness, fatigue, osteoporosis, become progressively more severe as women age. So it takes no great leap of intellect to presume that another effect of testosterone loss, namely breast irritation, also progressively becomes worse as women age, leading to an ever-increasing risk of breast cancer.